So less than 5% of dentists are Black. So my biggest thing is like, how do we change the ratio? That's what has become so passionate to me. How do we get more people who look like us in these spaces? And it's bigger than just, yes, we want more people and we want diversity and we want in this space for our own success, but also because of medical and dental equity, right? How many patients you hear about the maternal
mortality rate? It's crazy.
It's so crazy because when someone doesn't see someone who looks like them, they're a little more apprehensive, they're more fearful, and treatment is different. Let's just be honest. People don't want to talk about it. But are there amazing dentists who are non-Black who would not be racist or biased? I'm sure, of course. Right. But there's a lot that are. There was a doctor who just went viral, a dentist, pediatric dentist, who is a MAGA supporter, which okay, that's fine, and we don't care if you're Republican or not. That's right. We take an oath to do no harm.
Is that the Hippocratic Oath?
This is, we take an oath to do no harm, meaning if you are Black, white, Jewish, Muslim, Christian, I can't judge. I'm to do no harm no matter what. If you sit in my chair and call me the N-word, I still took an oath that I will either not treat you, but I can't do harm. Of course, so much isn't entrusted in us.
Absolutely.
So she goes on to like make a speech where she's joking and she says that for her Democratic patients, she purposely wears a hat that says like, make America great again. And when they say something, whatever, she turns the gas down.
No.
Yeah.
So that she can inflict pain on them?
So she said it was just a joke. It was like a whole ordeal.
Is she going to lose her license?
I hope so. Because that is crazy. Like, honestly, I don't care if someone sat in my chair and called me the N-word. I'd probably be like, I can no longer treat you. But if their mouth is open, I'm not going to be like, oh, let me give them this anesthesia.
You still have to do your best work.
Yes.
And you have to make sure that they're safe.
Exactly. And make sure they're safe, because that's why there's so small percentage of doctors in the world, because this is very important to understand. So that being said, there are a lot of patients who are getting unfair treatment because of who their doctor is.
Substandard treatment.
Yes. So imagine now if 95% of the dentists are non-Black and you're a Black person. I did a piece with Business Insider, and it was basically about why it was literally about athletes. Okay. So they reached out to me because I see a lot of athletes, professional athletes. Why, even with them, is there a decrease in their dental care or a decrease in their, keeping up with appointments? I guess they did some study. And I said, well, it's simple. It's so hard to get. So I don't care how many millions someone has. If they grew up in an environment that was underserved and maybe they went to a dentist who didn't like the color of their skin and didn't give them enough anesthesia and they were in pain, they hate the dentist. They never want to come back. I don't care if they have 50 million in their bank account. Right. They're like, this is not a safe space for me. And what I often hear is childhood trauma. Yes. And what I often hear is people say, well, you don't look like my dentist is like this old white guy. Because honestly, that's what's predominant in this field. So for me, it's been so heavy on my heart for literally the last 10 years. I've made it my mission to, how can we get more diversity in this field? How can we get more representation? How can we get more dental equity? And how can we get care to underserved communities? And the best way to do it is by increasing this ratio of minority people in the field.
How can we get more minorities in the field?
So I'm currently working on a scholarship that is really dear to me. And the goal of this scholarship is, a lot of times we give scholarship money to minority dental students while they're in dental school. Okay. But my belief is that there's a lot of minority students who qualify for dental school. But a lot of people don't know that the application for dental school is not cheap. For each school, back years ago when my mentee was applying, my mentee is brilliant. When I say genius, like genius, she's from Jamaica, born in Jamaica, went to UF. When she was applying to dental school, I wanted her to apply to Harvard. Harvard only accepted 30 or 35 people, and the requirements were high, but she had the requirements. But she was like, I can't risk it, because if she can only afford, if it's $500 per school, and you come from an affluent, generally white family, because that's this country, your parents can apply for 10 schools.
Exactly.
That's nothing to them.
Right. Just put it on the credit card.
Yeah. And may the best school win. But when you come from an underserved community and you have the test scores, but you're like, oh gosh, I'm nervous. I only have 1,500. That means I can apply to 3 schools,
Right.
500 apiece.
And you probably needed family members to contribute to that 1,500.
Exactly. So now you're like, I'm not going to pick Harvard because that's one of the hardest to get into.
Right.
So things aligned for her to be able to apply
Good.
to everywhere. And she went on to go to Harvard.
I feel like I saw this on social media.
Yes, she did. She graduated from Harvard, top of her class,
Wow.
gave the commencement speech.
What?
A Black woman from Jamaica. But imagine if she did not have the application money. So the scholarship I'm working on is, can we fund money to minority students at the undergraduate level to now cover their application fees so they can be at the same playing field as some of their counterparts who they have the same scores.
Yep.
They have the same GPA, but their family comes from...
You're right. They have a house in the Hamptons.
They cannot, so this family can't afford that. Can we give them the scholarship to allow them to apply? Just by doing that, the percentage of minority people who become dentists is going to skyrocket.
It's going to skyrocket.
So that's what I'm working on. This is something that I have not seen exist thus far. A lot of, like I said, scholarships do exist. So I'm working on it with a big company that we're...
Excellent. And are people going to be able to contribute? Like if people want to,
Of
that are
course,
watching, that maybe...
yes.
Do you have a name for the scholarship? Do you have a website
No,
yet?
because I can't. Soon everything's coming out.
Okay.
But we're working on all of the, stuff. And when it announces, I'm going to come knocking back on your door to be like...